Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Thank you so much for being here once again to answer these questions for us. If you have a question, we want you to text it to us. The number is right there on the bottom of your screen. It is 336-379-5775. Already getting some great questions in, Dr. Swords. And we'll start with this first one. Do you believe we are going to have a COVID-19 vaccine by the end of October?
I think the end of October might be a little aggressive. I think we will have data from many of the vaccine trials in the October timeframe, but for a company to have an effective vaccine and be able to declare it boldly and broadly, the end of October might be a little aggressive. By the end of the year, we'll have more data, and I'll hope with everyone else that we've got an effective vaccine by then.
And if a vaccine were to come out as early as October, how do we know that that is safe for someone to take?
It's a great question. So there are large-scale studies going on now, phase 3 trials, where many of our community members have volunteered to get the vaccine. We should have a fair amount of clinical data, whether it's effective, whether it builds an immune response. We should also have a fair amount of safety data available to us. So I think we'll have to rely on the studies to tell us whether it works and how safe it is.
All right, thank you for that. So a lot of people are starting to venture out more, maybe even go back to work because we are in phase 2.5 of reopening. Someone writes in, how efficient is it to take temperatures of employees at work? Because if they're asymptomatic, would they even have a fever?
Yeah, typically people will know if they have a fever and will have symptoms that accompany the fever as well. I think it is reasonable for companies to make a decision that they will take temperatures, and they need to have processes and policies in place that if they do identify somebody with a fever, what are they going to do with that information? Lots of companies are also either not taking temperatures but screening employees to make sure that people are not coming to work with symptoms.
So we talk about phases. We are in phase 2.5, but someone texted in a question, should we go back to phase 1 because people are still getting sick with this?
You know, it's hard to make a determination which phase we should be in. No matter what phase we're in, we should be following the same processes that I outlined earlier. If we were in phase 1, I would say, stay away from each other and wear a mask. In phase 2.5, I'm preaching the same song. Stay away from each other and wear a mask. Wear a mask all the time and make sure it covers your nose and mouth.
Someone asks, if you test positive, how long after your last symptoms will you be contagious?
Good question. We think that once symptoms are resolved, so no fever, no cough, other symptoms associated with coronavirus, that if you're symptom-free for 4 days, you won't be transmitting the disease after that.
Interesting. So 4 days. And then a lot of people are asking about, once you've been infected, can you get COVID-19 again? Dr. Swords, the first time I spoke to you about this virus back in March, we were getting this question.
Yeah, it's still a good question. And the answer is probably very similar, is it's hard for us to know whether people have been really reinfected with coronavirus. We do know that people who test positive for COVID, if they are tested 2 or 4 weeks later, they might still test positive for COVID with the very sensitive tests that we do, but we're also convinced that they're not contagious at that time. If that same person were to come back 3 months later with symptoms and still test positive, we don't know if their symptoms are related to COVID if it's related to another virus, and they still are carrying this RNA with them in order to test positive? It's a great question. We don't know all the answers right now.
Absolutely. Someone actually had a question about their specific test, Dr. Schwartz. They said they had another COVID test today, and when the nurse did the swab, it wasn't as deep in their nose as the first time, and they're worried about getting an accurate result. But this could be a different type of test, perhaps.
I think you're right, Maddie, there are different types of tests. Some tests rely on a swab that's a nasopharyngeal swab, that is a swab that reaches way up into the nasal cavity. And some tests rely on a more superficial nasal swab. Both tests are very accurate.
And we're already seeing people start to get their flu shots, which is great because we don't want to have to deal with both the flu and COVID-19. But someone says, I'm over 70. I took the high-dose flu shot in August and is wondering if they'll need to take another flu shot this season.
We don't think so. If people get an immunization once in the flu season, so if this person had it in August, they had this season's flu immunization, they really should be covered through the entire flu season. If somebody is really concerned and wants to get another immunization in December or January, there's no harm to doing that. It's probably not necessary, and there's no harm to get a repeat dose.
I've never heard of a repeat dose of the flu shot. Thank you for answering that. Someone also asked, how long after you are exposed to the virus would you be able to get a positive test if you got it?
Of course, the answer is it varies. We think that it takes 3 days for the virus to produce symptoms, and it's certainly possible that people could be tested positive prior to the 3 days. And so it just depends on how virulent, how fast the virus multiplies before someone turns positive and has symptoms.
Right, but just because you haven't tested positive yet doesn't mean you couldn't be carrying the virus, so you want to stay by yourself if that's the situation.
That's right. If you're exposed to COVID, you should self-quarantine, and we would recommend getting a test somewhere in the 4 to 6 day range after exposure.
All right, Dr. Schwartz is sticking around until 6 o'clock tonight, so keep those questions coming. You can text them to 336-379-5775, and we'll be right back.